Today's topic is about fractures around the knee joint, specifically fractures inside the joint of the thigh bone. As we know, we have three bones that constitute the knee joint: the thigh bone, the leg bone, and the patella or the kneecap. Today we are discussing about the thigh bone fractures as it pertains to inside the joint. Now, there are 2 points that are important in fractures around the knee. One, the force that goes across the knee is very high because, as you know, the thigh bone or the femur is the longest bone in our body. Second point, we have many strong muscles around the knee joint, so the chance of deformity, of deforming forces displacing the fracture is very high, and this forms the basis of treatment. For any fracture inside the joint, a CT scan is mandatory with 3D reconstruction. The reason being, if there is a step off in the joint, it cannot be clearly appreciated in the X-ray. If there is a slight turning, if there is a rotation, it cannot be appreciated. If there is a slight diastasis or slight distraction, it cannot be appreciated on the X-ray. A CT will show all these three deformities, and this forms the basis and the principles of surgical correction. When we operated, these three factors, that is, the step off is removed. We'll see to it there is no rotation or angulation. The reason for this is that if there is any step off or any rotation inside the joint, then the function of the joint will be compromised. There might be a stiff knee. The patient will find it difficult to walk also because a step off will cause rubbing of the adjacent joint and will result in degenerative changes, which will result in pain. So, joint fractures, CT is mandatory, and most often than not, they are treated surgically. Thank you.